I spent quite a lot of time at St Mary's Hospital, where our eye project was based.
St Mary's provide affordable healthcare for lower income Kenyans. We're very unique. We have a number of greenhouses, 3,000 orange trees, a farm with a dairy herd. We then have fresh milk for the hospital, and any remainder can be sold.
St Mary's have an amazing team, and they're unique in their approach towards their eye care. Rosalind is an ophthalmic nurse who was part of the eye project team. She's incredibly hardworking, incredibly dedicated.
So these are my daughters and sons. I always tell our patients not to discourage elderly people for medication, because even if they are to live only 2 days on earth and they can be given back their sight, they can be helped to see their grandchildren as they bless them.
He was left with one eye, which deteriorated with time. He was told that he has cataracts. Then he completely went blind.
George Odiembo is a phenomenal man.
I've probably done more than 10,000 cataract surgeries, but each eye is unique.
We share a passion for trying to do something with the skills we've been given.
He has seen me. He was being wheeled around, now he can walk for himself, and it is true, now he can see. He says he feels very happy until he feels the old age has gone. He's young.
He's young now.
The ultimate joy you get is when you reverse blindness. Sometimes it makes you want to cry.
It's one thing to be able to diagnose someone with an eye disease that you know you can treat, but the patients who are the most in need of treatment are the least likely to be able to afford it. And so we tried to find a way that we could subsidise that cost, and that's where the idea of the bakery came.
If the bakery runs at a profit, I think it will go a long way to make eye care service accessible to the community.
The first priority would be make sure the free cataract surgery program continues. Funding is always a problem, and in the public transport that exists, a lot of people just can't even afford to get here. If the funds are there, then we could look at a second vehicle here. Public education is always a problem.
Unless the eye is in pain, people don't go for medication.
We also need to overcome the fear of surgery.
A few people have suspicions that you are going to spoil their eyes. So we need a lot of community counseling.
Also, a large number of students don't have glasses, and so the other thing we would like to do is to start a program, Spectacles for Students.
There are a lot of people in the community who are unnecessarily blind, and at the moment they're still not able to access treatment. The bakery could potentially be a solution to both of those, and so we're really keen to see this happen as soon as possible.